I'm Tammy Mack, afternoon host of Radio Free 102.3 KJLH Los Angeles, and welcome to a series of podcasts that dive into what it means to be Black today and how we can overcome many issues facing the Black community. All compliments of the Black Infant Health Program. So today's series is Anti-Black Racism and Black Birth Outcomes. Today's panelist, Sandra Merriweather, San Joaquin County Public Health Nurse for the Black Infant Health Program. Hi, Sandra.
Hello.
Mecca Slaughter, Riverside participant in the Black Infant Health Program. Hi, Mecca.
Hi.
Alyssa Jones Garner is here, San Francisco Black Infant Health Lead Data Specialist. Hi, Alyssa.
Hello, Tammy. Hello, everyone.
And Supervisor Holly Mitchell, Supervisor of the Los Angeles County Board of Supervisors, 2nd District. Hi, Supervisor Mitchell.
Good morning, Tammy Mack. Thanks for having me.
Thanks for being here. So I want to let anyone take this particular question, our first question, because I think you all know about this question. Many Black women have had traumatic birth experiences, and it's been linked to the inherent racism in America. How so? How is that? We'll give that to you first, Alyssa.
It's the impact of racism and how it's playing into the behaviors, how people are feeling comfortable to interact with our women negatively. An example of that, one of our mothers, she was in the hospital in extreme pain, bleeding. And when she called for aid, she was told that, oh, it's nothing, don't worry about it. And she overheard one of the nurses tell another nurse that, oh, she's just drug seeking. And she was left in her room in extreme pain and duress during what's supposed to be one of the most beautiful moments in a woman's life. That is how it's impacting us. It's causing trauma, not just for the mother, but for the child. And we'll go into it a little later, I hope, but when it affects the child, you can physically see the changes that are happening to our infants due to racism that's being experienced by the mother while they're pregnant.
Wow, you can physically see it in the child?
Yes, it can be measured, and it has been measured in low birth weight. We're seeing children that are born less than 1,500 grams or less than 3 pounds at birth, that are born early, or how we say preterm birth, which is less than 37 weeks. But we're physically seeing changes in our children and how they're developing in utero due to systemic racism and prejudice that's being experienced by the mother.
You know, that's interesting. A lot of times the mother is blamed for having to have a C-section or having a baby that's premature. But it sounds like you're saying sometimes the hospitals are at fault for this. The doctors and the nurses, in terms of how they care for the mother, they themselves create these events that are so traumatic that it could send the mother into childbirth prematurely. Is that correct?
Well, I agree that's correct, because I think that providers need to address the chronic issues of the mothers. And a lot of times they'll go to the clinics and their hypertension will not be addressed. And then this further leads to other medical problems. And I think they need to address those issues and not to give these mothers elective C-sections. And, because the baby, in order for the baby to survive and gain weight and the brain to be healthy, the baby needs to stay in utero for as long as possible. But if we're doing all these negative things and not taking care of our mothers or listening to their concerns, that's one of the major issues, is not listening to African American mothers as if they have no issue, no voice or anything. And it's really hard on the mothers. And so I think that if we begin to focus on their health, address their questions, and get into a conversation of communicating well with them, then we could see some more changes and see healthier babies. They would have a better weight gain, and we can avoid prematurity.
And
Supervisor,
Tammy, I would take one step even further back, if you don't mind me jumping in here.
please.
When Alyssa talked about we could see it in the babies, sometimes that is a result of us living as Black women in a sexist, racist society, even before we present to the hospital. It's the stress. You know, I've joined the board of directors of the Birthing Project literally 30 years ago,
Wow.
and saw research then that talked about Black women, regardless of class. Because, you know, we used to think it was poor Black women who didn't have access to prenatal care. No, it's Black women trying to survive being Black women in America, whether you're upper class, middle class, whatever. And it's the stress in our bodies. We know how we tighten up what stress does to our body when we are experiencing these negative experiences, the microaggressions, all that we experience as Black women every day. Imagine what that does to the baby in utero, coupled with our experience with the healthcare delivery system, where research, documented studies suggest that there are healthcare providers that think that we have a higher threshold for pain, where we're ignored, where
Yeah.
comments like we've heard are made. And so it really is systemic in terms of our experiences as Black women, the stress we carry in our bodies, the impact it has on the baby in utero, and then our negative interactions with the healthcare delivery system. It is all that.
Mecca, I want to know, you were a part of the Black Infant Health Program. Did you ever, or did the Black Infant Health Program keep you away from experiencing these, you know, these particular issues when it comes to going into the hospital when you're pregnant?
I wouldn't say they kept me away, but more or less like prepared me for these interactions that could happen, because sadly, as Supervisor Mitchell said, it doesn't matter class. I mean, I remember going into I had a set of twins. And so I was high risk pregnancy at, you know, that was just that. I remember researching and saying, well, they even treated Serena Williams badly at the hospital. And she's like, you know, famous, you know, love Serena. But
Right.
and if they
a millionaire 2 times over, right?
Mhm,
So
yeah,
there's absolutely nothing inferior about her income.
yeah, yeah. And so I was like, if they would do that to her and how, you know, big that she is, then there'd be no problem with, you know, little old me. And so the Black Infant Health Program really prepared me to be like, sadly, this stuff happens to us. Even though we're in the year of 2021, well, I had my twins last year, but in 2020, you know, these items still happen to us. And so they prepared me, and I made sure that I had my birth plan. It was 4 pages long. And I gave one to every single nurse that was in the room, because there was because there were twins. I had twins. So there's like 10 nurses in the room, because when you give birth, everybody's on hands on deck. And there was one that looked like me. And so I was like, nope, everyone needs a piece of paper, because I don't have time, you know, for, you know, these things to happen to me. But they really prepared me for, and I remember going in the sessions every week. And towards the end of my my pregnancy, I was in the hospital like every week, or not every week, but my clinic every week, because of the high risk. And I would just update them.
Were they receptive to taking your birth plan?
Yes, they were. And that's because also we in the program, we would talk about the hospitals that we were going to be birthing at, and the clinics that we were birthing at. And so like this group of Black women were like, okay, don't go here, you should go here and maybe talk to this doctor, because they're going to be more receptive to what you have to say.
Yeah,
And
that's
so
so
that was
that's a part of the Black Infant Health Program that assisted you with which hospitals are more welcoming and inviting to Black women.
yeah. Hmm.
Amazing, but sad at the same time that we have to do that we have to prepare in that way. It's just
Mhm.
another step for us that we have to take that our counterparts do not have to take. And I don't believe that people understand what we go through as Black people. I'm just curious, uh, and many women out there may be curious too. I know you said you had a 4-page plan, Mecca. Can you
Yes.
give two things that were on that plan that were extremely important that maybe another mother to be would not think about?
Yeah, sure. I made sure because there's certain like shots that they give your child after they're born, and certain things that they have to do. And so I listed out what they can do and what they can't do to my child. I also said if they had to put me under, because when you have a multiple birth, they automatically take you to an operating room just in case something happens. And so I said my mother has to be in the room with me. So I wrote it out on the paper that Valerie Jones has to be in the room with me just in case I had to go under anesthesia or something like that. She was the voice for me. And so for my mothers out there, I was just very clear with everything I wrote down, just in case something happened on the back end, then I could go back and be like to my lawyer, I wrote all this down, and they made copies and highlighted the things. And so they knew what was going down. So, yeah.
Yeah. So I want to talk to you, Supervisor Mitchell. How does racism play out in the healthcare system? Because it would seem to me that doctors would want to care for their patients all the same. Is that a fallacy?
Tammy, I think implicit bias is real. And just because they're doctors and they go through training, unless we talk about racism and we help people identify their own implicit and explicit bias, they're no different from anybody else. They're no different from teachers in classrooms or police officers who see a Black man or woman and make assumptions. And so I introduced a bill when I was still in the California legislature, the Dignity in Pregnancy and Childbirth Act. And that's when I saw some of these studies done of medical school students where they really tested their implicit bias and learned about the percentage of future doctors who really assumed that Black women had a higher pain threshold, that our skin, because we were Black, was more difficult to penetrate for given IVs and shots. Just things that really stopped me in my tracks.
Almost
And so,
us.
without question, not almost, absolutely. And so we have to make sure, really in every profession, that we help people unlearn those implicit and explicit biases. So the point of the bill was to require that healthcare providers involved in all perinatal services at hospitals and alternative birth centers undergo evidence-based implicit bias training. So they would understand that when Serena Williams, not only because of her means, but she's an elite athlete, she knows her body. What was even more offensive to me in the Serena Williams case was she knows her body and she told them something is wrong and she was ignored. And so making sure that those who are going to be in the room, like with Mecca and her twins, have gone through a training to just be in touch with their own implicit bias.
Yeah.
So they can check themselves and not make comments like, oh, she's just trying to get drugs. All of us have our birth stories. My mother used to love to call me on be the first call on my birthday to tell me my birth story. And a part of the birth story, tragically, and it didn't occur to me years later how deeply inappropriate it was. She talked about, I was born in 64, I'll be 57 this year, at Kaiser on Sunset. And a part of my birth story was her doctor telling her, oh my goodness, you have childbearing hips. Even though this is your first delivery, this will be easy. You'll be ready to go home as soon as I deliver your baby. Because your ancestors, they dropped the babies in the fields and kept working.
Wow. The doctor said that?
Said it. And so, and after I became of age and, the birth story wasn't just, the fun birth story, I began to ask her, like, how did that make you feel? And so she then began to think back, like, that really was an inappropriate, horrific thing to say. All I was trying to do was have my baby and get out of the hospital. But can you imagine when you're, as a woman, at your most vulnerable, needing the assistance of a healthcare provider to help you bring your baby into the world. And that's his attitude, that you have
And you know what
childbearing hips, your
is
ancestors, and you should be able to do this easy and be gone.
what's interesting, Supervisor Mitchell, is that when I hear a story like this, assuming that the doctor was white, I don't know. You
He
could
was.
okay. When I hear things like that, you we respect and we look up to doctors as experts, as professionals in the field. And therefore, we take their words to mean something, have validity to them, and be actual facts. And so then we, as Black women, go around telling other Black women, oh, you have childbearing hips. It's not something that, I mean, I've heard that throughout my lifetime, not about my hips, because I ain't born no babies, but so apparently I don't have childbirth and hips. But, but you hear that, like you hear your grandparents or your great grandparents, oh, that child got child. And now we understand that these things come from our oppressors, and we take it as though it's nothing. It means nothing. And that's what sets in our mind. Okay, Sandra, I want to know
Yeah.
about how the Black Infant Health Program teaches women to advocate for themselves with the expectation that doctors and hospitals won't listen to them nor believe them when they say they feel pain or something out of sync during their pregnancy. How do you combat that with the Black Infant Health Program?
Well, we just had this discussion on yesterday when I was teaching them an educational topic to be their own advocate. And if they don't speak up, then no one will know that they have any concerns. So we talk to them and let them know that it's important to communicate with their providers. This is very important, and to have them also inform the doctor of any chronic conditions that they may have had even before they got pregnant, because the family history, and any chronic ailments that they have, this all will determine the care that they are going to be provided. And if they don't speak up, then something can, occur that's not real good for them. So we talk to them, we encourage them to speak up and let them know that, if you don't speak, then your voice won't be heard, and you can end up getting sicker because of not informing your physician. So communication is the key, and that is what we teach here. And I wanted to also stress that, we were talking about how stress affects the body. We also go into detail with them about how stress affects every every body system, like the brain, the skin, the cardiovascular system, the joints and the muscles, the immune system. And then we also help them practice to do deep breathing and exercise techniques that will help them calm their stress, get their stress level down.
Mecca, did you have that experience?
Yes, they that was one of the reasons I delivered my twins. They were a month early, 35 weeks, 6 days. It was due to a lot of stress. They were born in the midst of COVID, so that was one thing. But just a lot of stress going on, and they say that whatever you feel, your baby feels. And so on top of, COVID, but then on top of my doctors not listening to me and pushing to have a C-section, I'm like, no, I want to, give them birth. I didn't want to have a C-section. So I was like, no, but they're pushing, yes, let's do it. And I don't want to, that stress of going back and forth and things like that. So, I mean, it's just so sad, on top of everything.
Did you end up having a C-section or no?
No, I didn't actually. I gave
I don't think
both.
mothers to be know that they can request not to have a C-section. That is an amazing piece of information.
Yeah,
You can say, I don't want a C-section.
yeah.
Alyssa, what does the data show, Alyssa?
Well, aside from the data, I also just very quickly want to highlight the role of our family health advocates in empowering our women. to advocate for themselves and for the health of their children. They also take an active role. They can go with the mothers to their appointments. They do home visits. They also will help represent them when reaching out for other supportive services, which is extremely important to the life and health of our moms and their babies. But I really just quickly wanted to speak to that.
Excellent.
And in terms of the data, we're undergoing a lot of evaluations right now for the Black Infant Health Program to show its efficacy in reducing infant and maternal mortality rates. And we're seeing extremely good numbers, especially in the area of empowerment of our moms, that when they leave our program, they are fully supported, not only by the staff at our program, but by each other. We're building sisterhood between these women. They're sharing resources and knowledge with each other, much in the way that we used to prior to slavery, when we could speak about our experiences in childbirth freely and openly with each other, to share and nurture each other through this beautiful time. And I want to highlight how beautiful childbirth is. It is the act of creation, and it's something to be celebrated. And it's extremely unfortunate that for many of our Black mothers, that is not the case, that this experience of creating life is being made to be traumatic and to be tainted in a way by maltreatment within our healthcare systems, our social service systems. And that's something that Black Infant Health is actively combating.
Excellent. Many believe that the disparity in the immortality rate during births are exclusive to low-income women and families. And we've talked about that here. Serena Williams, but also Beyonce and Meghan Markle, and actress Tatiana Ali talked about her experience during KJLH's Women's Health Expo while having birth. Take a look.
My childbirth experience wasn't the best. I was also, it resulted in, an emergency C-section, and in my son having to spend several days in the NICU because of the traumatic nature of his birth, our birth in a way, because it started me on this work. One of the things that I'm learning, as you know, Tammy, I'm working on a documentary to share all the things that I've learned. I have 2 babies now. My experience was with my first baby. I had a very different experience with my second baby because of everything that I learned. One of the things that I have learned is that, socioeconomics in this, look, it should never matter, any woman, any person should be able to walk into a space and receive proper care, be listened to, be heard, be asked questions, be given choices, and have the right to make those choices for herself. That is absolutely across the board. But what I've learned is that, research is showing that those things that usually matter in our society, what school you went to, what your economic level is, none of those things matter. If you think about it, when you're in the hospital or you're in those spaces, you're stripped down. I don't have my special bag that shows people who I am or what, and I'm not speaking however I need to speak, in spaces to be treated a certain way, to make sure that the waiter really looks after me and things like, no. Like, I am here to birth a baby, and we're stripped down at that point, and none of those things matter. Like I said, they should never matter, but none of those things matter. And so the bias is across the board. What matters is that you're a Black woman, is what it's showing. And what I do, try to bring to spaces too is the thing that I know how to do, or that I've been doing for a long time since I was a little girl, is telling stories. And I've come across this concept of weathering, and, where it really gets down to the detail of even, what happens in placenta when we're under such stress, and different individuals in our community, Black women, my sisters, who have more than me, who have, you know, less than me in economically or whatever. We're experiencing these stressors, but I want to make sure that we know that, you know, it's not our fault that we're experiencing these stresses. That is it's a normal human response to what the society, where it has placed us, how it treats us, how individuals who are supposed to care for us treat us. In my birthing room, I had 10 people screaming at me. I had a doctor put his elbow in my stomach, trying to squeeze my baby out like I was a toothpaste bottle. I had, it was a horrific scene. We were treated terribly. And so of course, you know, there was stress because no one's answering a question. No one's sharing information. I've heard stories of women being told that they're seeking pain medication because they say they're in pain. Meanwhile, I have 2 cracked ribs and nobody bothered to check. You know, all of these things, child services being called in right after you give birth because they look at you and your partner, they look at your family and they go, I don't like what this looks like. I mean, there are horrific things being done. So that stress is a natural human response to what is happening around us. I've been more learning about the bias that occurs in hospitals, that the bias that occurs with doctors, you know, the belief that we don't experience pain in the same way. And when you talk about our history of slavery, you know, you go back to the so-called father of gynecology, J. Marion Sims, and the women that he experimented on, Anarcha, Lucy, Betsy, these 3 women who were slaves who endured incredible operations with no anesthesia, 18, 19, 12 times, 10 times, again and again throughout their lives. That is the person who came up with the speculum, or you know what I mean? That's the person who came up with a lot of the gynecological procedures that we use to this day. That empowerment, like knowing what to look for when you are seeking you know, looking for your team and putting your support team together, what to look for, what feels right to you, that what feels right to you is probably what's right, you know, knowing that you have a knowing. That's, I think, I remember my OBGYN, when I asked about different positions, he told me, he said, you know, you can hang from the ceilings if you want. So very dismissive. And I
Yeah.
remember that as loud as day, and I still didn't walk out of the room. I thought, oh, he knows he's a doctor, and, you know, I guess he's going to give birth for me. I don't like, it's just a complete paradigm shift that also has to take place, besides the institutional stuff and the structural stuff, of just really, you know, I feel like as women, as Black women especially, that intuition is the most powerful gift that we have.
Yeah.
And when trying to subdue us or our people or our communities, then that's the first thing that people try to take away in the most insidious kind of, you know, tiny, you know, minute ways. They try to take away that voice. This need for community is not a weakness. It is our greatest strength. It's our ability to create it, you know, under any circumstances whatsoever, is our greatest strength. And you know, so for anybody who's listening or watching this or whatever, and you feel like alone, reach out to this organization, get on your computer, figure out where, because it makes all the difference in ways that you can't even imagine, to just be able to walk with others, you know, on your own journey. It's the point of it. And I think our society as a whole just makes us believe that we're supposed to do it by ourselves, and we make our own little money and then we put it in the bank and we live in our own little house. We don't know our neighbors, you know, don't say hi. Something might, you know, there might be something scary. No, that's not how it really works. And that's not how our communities and our families thrive.
Supervisor Holly Mitchell, I'm on you now. You have sponsored the SB 464 California Dignity in Pregnancy and Childbirth Act. What does that bill entail? And please share the work you have done to address implicit bias and improve racial disparities in Black birth outcomes.
I appreciate that. And it really has been a career-long experience going back to my own employment with the California Black Women's Health Project, my 20 years of board service with the Birthing Project USA. And so every, stage of my professional career, both as a board member and policymaker, I've tried to bring this issue forward. Was very proud as chair of the Legislative Black Caucus to make funding Black infant health programs at the state a priority again. There was a far too many years where that program was just starved of state resources. So I was proud to put $8 million in it one year, and Governor Newsom came in his first year in his administration and matched it again with another $8 million. So at the state level, we built the coffers to help fund these programs across the state, and I'm very proud of that work. The bill you talked about was really addressing the issue of implicit bias around the healthcare delivery system. We looked at this University of Virginia study that talked about the attitudes of healthcare providers and their core belief, Tammy, that Black women have a higher threshold for pain, our nerve endings are different than our white counterparts, that our skin is more difficult to penetrate. And so this bill says that if you are involved in any way in birthing centers or in hospitals in the delivery of children, that you have to go through implicit bias training, because we need to check those biases. And so this is ways that I think policymakers can stand up and take data, take experiences like we've heard from Mecca, and bring forth public policy to really help change the experiences Black women have. I have to say, I was so proud to hear Mecca talk about her birth plan, because she was empowered. She handed it out to every healthcare provider in the room and took control of the situation, because those were her babies and her body and her birth experience. And Tammy, you and I could take a lesson from Mecca, that even though we're not going to birth no babies anytime soon,
Right.
all of us should have a health directive or feel empowered anytime we talk to a healthcare provider. Yes, they are the professionals in train, but they don't know our bodies better than we do. And we have to learn them and pay attention and listen to our bodies and be empowered. We have to go with our sisters. It's always good. Black Women's Health Project taught me that if you're perhaps going to get some bad information or negative diagnosis, take a health advocate with you. And Tammy, I could be your health advocate and you could be mine. It doesn't have to necessarily be someone who's trained, just another set of ears, someone who's going to write down and take notes. And so these are lessons, whether you're delivering a baby or not, we as Black women need to incorporate into our regular life experience to protect ourselves.
Yeah, I agree. I had a horrible experience at the hospital one time when they kicked me out. And I had gone by myself because I was so ill, and it was late at night. I was coming from an event, and I just drove myself to the hospital. And yeah, I went in, they shot me with an IV. I don't know what was in the IV. And then the next thing I know, the nurse was telling me I had been there for 2 hours. I had to leave. And I was like, I can't function. I don't even know how to stand up right now. And he said, well, you're lying. I don't believe you. And they called the police on me and kicked me out of the hospital. It was Encino Hospital. And I mean, it was such a traumatic experience for me that I barely even go to the doctor anymore, Supervisor Mitchell. I hate to admit it, but I can't imagine. I said that to say, I can't imagine a woman who is pregnant, welcoming a beautiful baby into this world, having to deal with something like that. It can't be good. But I'm glad that the Black Infant Health Program is good. I want to ask from everybody before we close out the panel, what's the one thing a mother-to-be should do? The one thing that they should do you believe, Mecca?
So many things, but one thing that I think for a mother to be is to have an advocate with you wherever you go. I mean, and we mentioned it. For me, it was my mother, because during COVID, you couldn't have everybody in the world in the room with you and things like that. And even now, there's still kind of regulations on that. But making sure you have someone that has your best interest in heart and knows if your birth plan, knows it back and front, as much as you do, if that be a mother, a grandmother, an aunt, friend, a spouse, or anybody, making sure you have that advocate to speak for you and knows your best interest.
Alyssa, one thing a mother-to-be should do.
I would say embrace what's happening to your body, embrace the changes, embrace the life that you're growing inside of you.
Oh,
And
that's a
so, especially if you're a new mom, because you are taking part in the act of creation. You are nurturing new life with your very being, and embrace that. That is a beautiful experience.
that's good
And
because
don't allow
physically, internally, and externally. And a lot of mothers are like, oh, my nose is big. Oh, my belly's big. Yeah. And to embrace that, that's very important. Sandra, what you got for me?
Well, I would say to all mothers to utilize your voice and to be very proactive when it comes to your health. You know, inform your physicians of chronic ailments and let them know of a family history because that's going to determine your outcome of your birth. And I think that they would have to learn to speak up and not be silent because no one can read your mind. And sometimes that may be what can also hinder the progress of
Right. So
a
bring in an
positive birth.
advocate, speak up for yourself, use your
Yes,
voice, and embrace the change. Supervisor,
embrace it.
us on home.
Well,
One
thank you for this.
thing.
Thank you for this opportunity for us to all come together. I'm so proud of the work that each of these women are doing in their communities to help Black women have a positive experience in their birth outcome. You know, the one thing is to have a plan. You know, I have a 20-year-old son who tells me every day, adulting is hard. It is, but we have to step up into the space and to have a plan. It may not be as extensive as Mecca's plan, but to think through your plan and communicate it to someone, to have an advocate. I think when I hang up my public policy job, Tammy Mack, I want to be a doula or nurse midwife.
Oh, wow.
Holly, I'm named for my paternal great grandmother, Holly Blanks, who was a midwife. So I think it's in me, Tammy. I think I'm supposed to help bring babies into the world.
In your voice. I feel the
So have an advocate. Talk about your experience. You know, yes, we want to avoid cesarean section. Sometimes you have to have it, but cesareans are not only disproportionately impacting Black women, but it's the bottom line. If a doctor can schedule cesarean, then he knows he can schedule that cesarean at noon on Friday, and he didn't have to be on call on Saturday.
Yeah.
So the healthcare delivery system is directing women in that direction because of economics and convenience. We have to stop saying, I want my baby born on a Friday because blah, 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 and let nature take its course.
Ooh,
we have to follow nature, our bodies. Women have been birthing babies since the beginning of time. And so we need to be mindful of that, but to have a plan, communicate your plan, and have a friend and advocate, someone who will be there to fight for you maybe when you can't.
Yes, and look, we're all proof that women have been having babies, right? I mean, life goes on, and the only way it can go on is if women have babies. I want to thank
healthy ones.
One of you, Alyssa, Sandra, Mecca, and Supervisor Mitchell for being a part of this Black Infant Health Program series. I'm Tammy Mack from Radio Free 102.3 KJLH Los Angeles. Have a great day, everyone.